Do you know what happens when you overdose on paracetamol? It's not as simple as popping too many pills and feeling a bit off. It's a serious, potentially lethal situation. Paracetamol, also known as acetaminophen in the United States and Canada, is a safe and effective medication for pain relief and fever reduction when used correctly. However, an overdose can lead to hepatotoxicity, a harmful condition affecting the liver. This risk is higher for people with underlying liver disease or those who consume alcohol regularly. The maximum recommended acetaminophen dosage is 4 grams per day for adults and 90 milligrams per kilogram per day for children. Any amount exceeding this can lead to an overdose. The unsettling aspect of an acetaminophen overdose is that it's not immediately obvious. Symptoms of end organ toxicity don't show up until 24 to 48 hours after ingestion. Therefore, understanding the time, quantity, and formulation of the ingested acetaminophen is crucial. The toxic doses vary. For adults, it's between 7.5 to 10 grams, and for children, it's 150 milligrams per kilogram, or 200 milligrams per kilogram for healthy children aged 1 to 6 years. Now, what exactly happens when you overdose on paracetamol? The process is divided into 4 phases. In the first phase, which occurs between half an hour to 24 hours after ingestion, symptoms include anorexia, nausea, vomiting, and malaise. The second phase, between 18 to 72 hours post-ingestion, is characterized by right upper quadrant abdominal pain, anorexia, and nausea. The third phase, also known as the hepatic phase, occurs 72 to 96 hours post-ingestion. This phase is marked by hepatic necrosis and dysfunction, leading to jaundice, coagulopathy, hypoglycemia, and hepatic encephalopathy. Finally, the recovery phase, which can last from 4 days to 3 weeks post-ingestion, is when symptoms and organ failure start to resolve. Diagnosis of an acetaminophen overdose relies on a series of diagnostic tests, including an assessment of acetaminophen levels, electrolytes, kidney function tests, amylase, lipase, liver function tests, complete blood count, and coagulation factors. The management of an acetaminophen overdose is time-sensitive. The goal is to start treatment within 8 hours of ingestion. This includes using activated charcoal to absorb the paracetamol in the stomach, administering N-acetylcysteine as an antidote, and providing supportive care. Prevention is key. Always take paracetamol as directed, don't exceed the recommended dose, and don't mix it with other medications containing paracetamol. And remember, always keep it out of the reach of children. In summary, an acetaminophen overdose is a serious situation that progresses in phases, each with different symptoms. Diagnosis and management are crucial, and prevention is the best approach. So next time you reach for that bottle of paracetamol, remember to use it responsibly.